Okay, we're going to look into the images and slides for the practical 2 Respi. Okay, the first image is bronchopneumonia. So you can actually see the difference between these two lobes. Okay, the first lobe appears very airy, and these lobes appears very mucoid and dense. So the dense parenchyma of the lung is called as consolidation. Why it is dense? Because it is filled by pus and fluid. Next, we are going to look into lung abscess. So this is actually the lung parenchyma, the low power. You can actually see this is actually quite airy. It has a lot of air inside the small alveoli. But in this area, you can actually, this areas, the parenchyma become very compact. Okay, and it is actually yellowish because it is filled by pus. Okay, and evidently some of the pus will cause destruction of the tissue, like here and there. So this is the pus area that has been cleared up, and this forms a cavity. So basically this is actually the areas of abscess with the cavity, and surrounding it are areas of consolidation. The next is primary tuberculosis. So there's two lesions that you should be able to recognize. First is the one at the periphery known as gone focus. Okay, gone focus. And the second one is actually near to the hilum. The calcification near to the hilum is known as gone complex. Okay, the color is yellowish whitish lesion. It's actually a very small lesion at the parenchyma of the lung. The next one is secondary tuberculosis. So basically you can actually see the very badly consolidated lung here compared to the lower part. Okay, the upper part of the lung, and you can actually see there's a cavitation there similar to abscess just now, right? But this cavitation is usually very large, and it has a fibrous capsule that line the cavity. Okay, and surrounding it similarly as like an abscess just now, that's the area of consolidation. Next is miliary tuberculosis. So this is actually not a section of the lung. This is actually a section of the spleen. So basically, miliary tuberculosis can occur in all part of human body, but the features is almost the same because you can actually see there's a lots of these small whitish lesions. Okay, it looks like a millet seeds. So that's the reason why it is called millet seeds like consolidation in the parenchyma of any organs, either lung, kidney, or even spleen as shown in this image. The next one is lung adenocarcinoma, gross. So in cancers of lung, typically, if you have a lesion or tumor at the periphery side of the lung, okay, it's basically adenocarcinoma. Okay, and this is actually cancer because you can see all the features of malignancy here. It has poor demarcation, not well encapsulated. The cut section is heterogeneous with areas of hemorrhage, the blackish, and necrosis, the yellowish. Okay. And the next gross tumor that we need to look into is lung squamous cell carcinoma. So this one is actually a bit different because usually it is actually a central tumor. Why it is central? Because it is actually near to the major airway. Alright, because this is actually usually arising from a bronchus that has gone into squamous metaplasia, and then squamous dysplasia, and then later on squamous cell carcinoma. So you can actually see the tumor near to the bronchus, and also having similar feature of malignancy is actually poorly demarcated, not well encapsulated, and the cross section is heterogeneous with areas of hemorrhage and necrosis. Okay. So for the virtual slides, the link will bring you into these images. Okay, you can actually click the button up there to maximize the image. And the first one is bronchopneumonia. So when you look into the higher power of the image, you can actually see there's a lot of alveoli. Some of it are clear, which contains air, but majority of it are actually filled by neutrophils inside the alveoli. So presence of neutrophils exudate, what we call them. Okay, it is not just neutrophil, it is actually neutrophil with tissue debris, necrotic tissue debris, also what we call as neutrophilic exudate inside the alveolar wall, inside the alveolar space. So we call them as pneumonia, bronchopneumonia. Okay. The next one is abscess. So the thing you can actually see that there's actually a space, there's actually a lung tissue there, but suddenly there's actually a big cavity over here. Okay, big cavity with something inside there. So when you have a look properly, so you can actually see there's actually this cavity is having I mean, basically this completely destroyed the normal alveolar structure. So this is actually a lesion that completely destroyed the alveolar structure, and it is composed mainly by neutrophil and neutrophilic cellular and the tissue cellular debris that is necrotic. So this is actually a neutrophilic exudate, right? And it actually it is actually named as pus, or also known as abscess. So this is a feature of lung abscess. The next one is pulmonary tuberculosis. So you can actually look into the tissue, the virtual microscopy there, the slide there, and you can actually focus on any point, and you can actually see all the four main features of tuberculosis as you have learned in your basic pathology. So the central part is actually what we call as caseating necrosis. Okay, central caseating necrosis. And surrounding it are inflammatory cells, is chronic inflammatory cells, because one, you can see a lot of neutrophils, the small nuclei cells, right? And you can also see there's a lot of the sleeper sheep cells there, okay, at the periphery. So the sleeper sheep cells is called histiocytes, and collection of histiocytes is known as granuloma, right? And one peculiar cells that you can actually see is actually these cells, okay. This is all what we call as giant cells. You have seen this before. So this is all the four main features for pulmonary tuberculosis. And the next one is lung adenocarcinoma. So you can actually see there's actually lung tissue with a tumor there. Okay, and when you focus inside there, you can actually see this is all malignant glands. Okay, this is all malignant glands because it is actually very irregular, and you can find all the five features of malignancy there. You can see it is hyperchromatic, pleomorphic, high NC ratio, and some them having mitosis as well. The next one is lung squamous cell carcinoma. So this is actually a very guided slide. You can actually click at the location to look into the slide, but the two most important findings is actually looking into a peculiar feature of squamous cell carcinoma, which is keratin pearl. Okay, this is what we call keratin pearl. This is also another keratin pearl, and this is all the malignant cells of malignant squamous cells, having all five features of malignancy such as pleomorphic, pleomorphism, high NC ratio, mitosis, as well as necrosis. All right, that's all. Thank you.